Monkeypox, a name that's been making waves, but what exactly is it? How did it start? What causes it? And what should you be looking out for? If you've ever wondered about this virus, you're in the right place. In today's video, we're breaking it all down, from its history to its causes and symptoms. Stick around, the facts might just surprise you. Hey there, welcome back to Health Talk. Today, we're going on a journey to understand monkeypox, a disease that's been around for a while but is suddenly getting a lot of attention. We're going to look at where it comes from, how it spreads, and what signs to watch out for. If you're new here, make sure to hit that subscribe button so you never miss out on important health information. Let's jump right in. Did you know that monkeypox has been around for over 60 years? But why are we just hearing about it now? Monkeypox was first identified in 1958, but not in humans, in monkeys that were being used for research. That's actually how it got its name, even though monkeys aren't the main culprits in spreading it. The first human case was discovered in 1970 in a child from the Democratic Republic of Congo. From there, most of the cases were found in Central and West African countries, especially in areas close to tropical rainforests where the virus is naturally found in animals. For many years, monkeypox stayed pretty much under the radar, mainly affecting people in rural parts of Africa. But in recent years, we've started seeing cases pop up in other parts of the world, which is why it's suddenly become a hot topic. Increased travel and possibly changes in our environment have helped the virus spread beyond its usual boundaries. Now that we know where monkeypox comes from, let's talk about what actually causes it and how it spreads from animals to humans. The name might make you think monkeypox comes from monkeys, but is that the real story? Monkeypox is caused by the monkeypox virus, which is part of the same family of viruses that cause smallpox. The virus lives mainly in animals, and here's the surprising part. Rodents like rats and squirrels are actually the main carriers, not monkeys. These animals can carry the virus without getting sick themselves. Humans can catch monkeypox through direct contact with an infected animal's blood, bodily fluids, or through bites or scratches. For example, people who hunt or eat wild animals in regions where the virus is common are at higher risk. Once the virus jumps from an animal to a human, it can spread from person to person, although this is less common. Human-to-human transmission happens when there's close contact with an infected person, especially with their body fluids, sores, or respiratory droplets, like when someone coughs or sneezes near you. It's important to note that it usually takes close, prolonged contact for the virus to spread between people. Now that we know how monkeypox spreads, let's talk about what happens when someone actually gets the virus. What should you be looking out for? Would you be able to recognize monkeypox if you saw it? Let's break down the symptoms. When someone catches monkeypox, the symptoms don't show up right away. It usually takes anywhere from 5 to 21 days for the first signs to appear. This period is called the incubation period, where the virus is in your body but hasn't started causing symptoms yet. The first symptoms of monkeypox are a lot like the flu, which makes it tricky because it can be easily confused with other illnesses at first. Here's what typically happens. Fever. This is usually the first sign that something's wrong. Your body's temperature goes up as it tries to fight off the virus. Headache. Along with the fever, you might start to feel a throbbing pain in your head. Muscle aches and back pain. Your muscles might feel sore and achy, especially in your back. swollen lymph nodes. This is a key symptom that helps doctors tell monkeypox apart from other diseases like chickenpox or smallpox. You might notice swollen lumps in your neck, armpits, or groin. Chills and exhaustion. You might feel extremely tired and have chills, even if you're warm. After a few days of these symptoms, the most noticeable sign of monkeypox appears: a rash. This rash usually starts on the face and then spreads to other parts of the body, like your hands, feet, chest, and even inside your mouth. The rash goes through different stages, and this is what makes it very distinctive. 1. Macules. These are small, flat spots on the skin that are usually red. 2. Papules. The flat spots then turn into raised bumps. 3. Vesicles. The bumps fill up with clear fluid, becoming blisters. 4. Pustules. The blisters then fill with pus, which is thick and white. 5. Scabs. Finally, the pustules form scabs that eventually fall off. The rash can be itchy and painful, and it usually lasts for about 2 to 4 weeks. Most people recover fully, but the virus can leave scars where the rash was, especially if the skin is scratched or picked at. In some cases, monkeypox can cause serious complications, like infections in the lungs, pneumonia, infections in the blood, sepsis, or even inflammation of the brain, encephalitis, particularly in people with weakened immune systems. So now you know the signs to watch out for, but remember, the best way to deal with any illness is prevention. That wraps up our deep dive into the history, causes, and symptoms of monkeypox. It's always better to be informed, especially when it comes to your health. By understanding where this virus comes from and how it affects the body, you can take steps to protect yourself and others. If you learned something new today, make sure to give this video a thumbs up and share it with your friends and family. Do you have any more questions about monkeypox or other health topics you'd like us to cover? Drop them in the comments below and we'll do our best to get you the answers. Don't forget to subscribe for more videos that keep you informed and healthy. Thanks for watching, and until next time, stay safe and stay healthy.